Yeah, guys, welcome to the platform. Everyone who will be here, everyone will be watching, anyone will be here at the moment. This is another day. Today is on Tuesday, right? It's on Tuesday, and yesterday I said I'm not going to give my direction. People will give their direction. People will give their direction, and the direction was topics that people want me to talk about. Topics that people want me to talk about will be brought into table, and then we see what we can do. So we decided that we'll be starting with let me see. We decided that we'll be starting with fibroids. Hemorrhoids and fibroids and fibroids. So let me see. So this is the day. There are several topics that we want to talk about. There are several topics that we talk about, and sometimes you give people what they want you to. You give people what you want. What is this doing? They want you to talk about. So today we will talk about two topics, and we'll talk about the topic that people have given, and so if you're coming in right now, hemorrhoids is the topic, or they're called piles. That is what we're gonna talk about today. Be free to welcome in. Be free to welcome in the chat. Be free to welcome in the chat, and we talk about these issues that occur to some people. Someone who asked about the forgiveness is underrated. There is someone who forgiveness is underrated. He goes by the name of forgiveness is underrated at YouTube, and we're gonna talk about piles. We're gonna talk about piles. Some people are suffering so much because of this complication, the piles. And if you see someone has requested that we do piles, that person has really had a big problem. So welcome everyone. If you are getting in right now, my friends, where you are, let me get to know you. There is that song that I love that is called "Let Me Get to Know You." Let me find it. Sometimes when I've not listened to any song through the day, I feel so bad. Let me, yes, it's called "Let Me Get to Know You." Let me listen to that a bit before we start. Some copyright issues, but we manage them. But music is life. Before we start, while I'm welcoming some people, you say, "Let me get to know you." Let me get it down. Let me get it down. We talk about let me get to know you. Welcome my friends to the chat. Welcome my friends. The driver today of the chat is Benjamin. Wise guy. Benjamin the wise guy is the driver in the house. The driver in the house is me. And you know what we do is we talk about medical issues in the platform. we talk about medical issues in this platform, and let me get to know this track. Sometimes music is a good thing. Music is a good. So we get to know some people here. Let me get to know you. Ooh. yeah. It's called Queen Ifrika. Queen Ifrika is saying, let me get to know you. Let me get to know you. Ooh. Okay, now today we are going to talk about piles. Piles are those things that come from behind there. Those things that come from behind there, and sometimes they are very painful, very irritating. Have you ever met someone who has piles? You will feel for that person, my friend. That person cannot sit down within hours. That person cannot sit down within hours because you are sitting on the piles, and they are irritating the nerves down there. So welcome, my guys. Welcome where you are. Welcome where you are chilling from, where you are. I say welcome to my channel. This is Benjamin the Wise Guy. I've just come in right now. I'm just tuning in to say that today we're going to talk about piles. Piles is the topic of the day. Piles. But we're going to bring this in a bit.
Wow, you surprised to hear a girl talk, so
listen to that.
I don't know, man. Just ask her what you want. Alright, let me get to know you. Let me get to know you.
Let me get to know you, who you are watching from, where you are watching from, and which side you are chilling at. Today we are talking about piles. Piles is the topic of the day. Piles have disturbed so many people, and it's painful for some people when you have piles. Have you ever met someone or talked to someone and that person told you that they are suffering from piles? Piles is a bad thing. Piles is a complicated thing. Piles is a thing that can make you not to sleep tonight. So welcome everyone who is in the house. Welcome everyone who is here. Welcome who is here. I'm still welcoming people as I'm planning ABCD. So the topic of today is piles. Piles is the topic of today. Do you know what piles is? You know what piles is? Let me introduce you and tell you.
Listen,
I'm welcoming people here, and I'm saying,
let me get to know you.
Come on. Let me get to know you. Jamaican uncle, the emperor himself in the house. Jamaican uncle, emperor himself in the house. So I'm asking you, friends, I'm asking you, where are you chilling at? Where are you today? Where are you relaxing today? Where is that day? Today it is a chilly day here where I am. It's a chilly day where I am, and being a chilly day, it's a bit when it's chilly. Greetings to you, Dr. Benjamin, and everyone else. Greetings, Jamaican uncle. Uncle, I'm just telling people, let me get to know them, welcoming them to the platform. Let me get to know you.
Let me get to know you.
Let me get to know you. Where are you from? Where are you chilling from? Where are you from? This is a session of welcoming people, and I'm saying,
let me get to know you.
Let me get to know you. Let me get to know you, my friends. If you are a new person, just go to the chat. If you are a new person, tell us where you are from. Tell us where you are chilling from. But remember, the topic of the day today is called hemorrhoids. Sorry, it is called hemorrhoids. Hemorrhoids is the topic of the day. And there are so many topics that I was given: spleen function, how to get twins, lack of iron, and that was by Leila Alimig. Spleen functions, and forgiveness is underrated. Told me to talk about hormonal balance, multiple melanoma, and how to cure rhinitis. That is Simple Kate told me to talk about it. Hemorrhoids and treatment. Forgiveness is underrated. Is told me to talk about it. Complications of POCs, PCOs. Someone says PCOs. POCs are polycystic ovarian syndrome. That one is Marjay. Marjay told me to talk about that, and also liver cancer. Complications of the eye complications. That was from Leila. Requested to talk about that. But right about now, as we introduce people,
Get to know you. Let me get to know you. Let me get to know.
Let me get to know you. Where are you relaxing from? Where are you chilling from? Where are you chilling from, my friends? Let me get to know you. If you are new in the platform,
Let me get to know you.
Listen.
Let me get to know you.
Yes, let us get to know each other. If you are a new person in the house and you're wondering what we do here, what we usually do here is a good thing. We talk about medical issues. We talk about issues that are concerning health. We talk about those issues. So check out check out the topic of the day written there. You'll see hemorrhoids, and we would like to know what hemorrhoids are. But right about now, we get to know you.
Let me get to know you. Let me get to know you.
Yes, let me get to know you. Where are you from? Where are you chilling at? Which side are you relaxing, and which place are you at? Before we start talking about hemorrhoids,
Let me get to know you.
Let me get to know you before we start talking about hemorrhoids. Let's get to know each other. Which places you are chilling from, where you are. Let's get to know everyone who is here. You are chilling from. If you are new to the platform, the chat is open. Tell us where you are from. Tell us where you are relaxing from. Tell us where you are from. If you are new to the platform, your support is good. It's fine. When you are here and you are a visitor, your support is good. Tell us where you are watching from. Tell us where you are chilling at. Tell us where you are, where you are feeling this vibe from. But my thing is always say that listen to this. Listen.
Let me get to know you. Let me get to know you.
Yes, let me get to know you. Let's get to know each other here. Let's get to know each other now. Let's talk about hemorrhoids. Hemorrhoids is a topic of concern. It's a topic of concern. Hemorrhoids are swollen enlarged veins in the lower rectum or around the anus. Lower rectum or around the anus. Those are hemorrhoids. So if someone asks you what are hemorrhoids, you tell that person there are veins in the lower rectum and around the anus. Most of them are veins because veins are superficial. If you go and talk about the other one, which is if we talk about arteries, those one cause aneurysms. They cause aneurysms. The anus, similar to varicose veins. You see, varicose veins are expanded veins because they have lost their tension. They occur when pressure increases in the rectal area. When pressure increases in the rectal area, they do what? They become bigger. Okay? You see, they become bigger. So they are very common in adults and may cause pain. They may cause pain, bleeding during bowel movement, itchy, swelling, a lump near the anus. Because if this is the place and it is coming through here, you will see a lump that is near the anus. You get? So if you have a question about that, how they come, we will talk about how they come. They are very painful. The complications, the hemorrhoids complications. If you don't know what hemorrhoids are, you tell me, I draft them. I draw what hemorrhoids are. Hemorrhoids can be painful until they can bring several complications. They can give you several bad complications, the hemorrhoids. I know some people don't know piles because they have never seen the piles. But you will find that. Let me draw a figure to show you how piles are. How piles can be. Illustrations are good because illustrations give us an overview of several things. So these are piles. I'm kind of like drawing what piles are. If you are watching me from anywhere, please tell me I'm watching this side and I'm learning ABCD. So the coffee cakes is here. Look at this. These are coffee cakes. Welcome. Hope coffee cakes, at least you're doing good. So I'm drawing something that is so this is what we call. Now check the red things. This is a blood vessel, the artery. This is an artery. Oh, Chwea, how are you doing? It's Chwea. Hope you are doing good. Look at this picture. Let me put a light so that people does not see that I am a black person who is looking like a black South Sudanese. Look here. This is the red one, the red place, the red one. Let me move closer. You see this red place, this red one is the vein. So it comes, and then because of high pressure it protrudes from in the rectum. So this is the rectum where you pass feces. It protrudes inside, So because it has protruded outside because of pressure, anywhere, this is anywhere, anytime. Knock, knock, knock. Anywhere, anytime is here. Anywhere, anytime is a good madam from my channel. People who are really supportive. Anywhere, anytime. Thanks a lot being here. Anywhere, anytime. You can meet anywhere, anytime, any person, anywhere. Now we are talking about hemorrhoids. You see, I'm trying to explain. I don't know if my figures are being seen. If my figures are being seen, yeah? Let me draw something bigger. So this one's. Let me draw something bigger so that people can understand. So that these things are really painful. If you are watching and you are new to the channel, do the necessary. Subscribe if you have not subscribed. Like if you have not liked. And let's have the good play. If you have ever met anyone who has hemorrhoids, please tell me. Hemorrhoids, please tell me now. You see the red things? These ones are the veins, and then they are protruding outside. And when they are protruded outside, when they are anywhere, you see, this is your down there. Some words, some medical words you cannot say them directly. You see, some medical words you cannot say that them directly. Why? Because in the society they are complicated. You see, in the society they are complicated. So you just illustrate so that people can understand. So I've drew a figure. I've drew a figure. Aristopat, today you're here. Long time Aristopat. You see, this is a person. So these are veins that are protruding at the anus region. There are veins that are protruding at the anus region. Those are called hemorrhoids. And what China Merisimba, hello, how is the going? Aristopat, how is the going? Everywhere. Oh, I was talking about hemorrhoids, that people are coming in and I'm not welcoming them. Let me welcome my friends. Anywhere, anytime, China Merisimba, Jamaican uncle, everyone, the coffee cakes, everyone, the coffee cakes is here. Everyone who is in the house, my friends, welcome, my friends. Big up every time. And as we learn, we communicate and we talk. Aristopat, no, I was there on your live when you was at the restaurant. Oh, Aristopat, the weekend head, up and down. I couldn't even come online and talk about issues, but at times it's good to take a break and do some things. So what do you understand by what we call hemorrhoids? If you are watching, please remember to hit the like button. And if you are a new person, tell us from the chats where you are watching from. Sitting too long on the toilet and struggling can make them worse. Best to take a stool softener and eat soft food for a bit. Sits bath work too. Yes. I have it, Dr. Benjamin, my doctor. I did a procedure and get rid of it, but it was a bit painful and uncomfortable. Yes, they are very uncomfortable. But you see, my friend, the Coffee Cakes is advising us what you can do. Coffee Cakes is advising us what you can do when you have them to live better, because they are very comfortable and they are painful now. Who is that watching and not having liked? Like, and new people that are in the house, tell us in the comment section where you are from. It's Tasha. Good morning, Tasha. Tasha does faceless streams. I've always wanted to see Tasha's face, but every time I'm on Tasha's streams, she's always faceless. The streams are always faceless, and I always text there. Tasha, hope you are good. Welcome to the stream. Welcome everyone that is here. Can hemorrhoids heal by themselves without surgery? Yes, we can. They can. Let's see as we continue. Aristopat, we have just started, and I'm welcoming everyone. This is what he was saying. Hit the like button. Let's get the impressions. Everyone who is watching, hit the like button, my friend. If you are a new person, tell us where you are from. Oh, I've welcoming note. Listen, my.
Let me get to know you. Let me get to know you. Let me get to know.
Let me get to know you. That is why I always sing, let me get to know you. You see, new people come in. Let me get to know you. Let me play this again. My friend, Queen Ifrika, tell them.
Let me get to know you.
Let me get to know the new people. Don't be shy. Hit the like button and come to the chat. Tell me where you are from. Tell me where you're chilling from. New guys, my friend. I usually say, you guy, my guy. You guy, my guy. Let me get to know you. 3 dots to the right. You know what to do. Smash the like button, yo. She's the stream too. That is, my friend, the Coffee Cakes. What do you understand by hemorrhoids? What do you understand by hemorrhoids? But right about now, as the new people are coming in,
let me get to know you.
Let me get to know the new guys. Where are the new guys? Why are you shy, my friend? Why are you shy? Why are you shy? Come on, tell us where you are from. Tell us where you are chilling from. Tell us where you are from. So, hemorrhoids in the normal way, they are called piles. Hemorrhoids in the normal way, they are called piles. Piles, they come down there and because of some issues, and the common, they are very common in some adults. They are very common in some adults, and they cause pain. They cause bleeding during bowel movement and itchiness and swelling. A lump near the anus. You will find a lump that has come out from the anus. You see, like this one. This is a figurative thing that I've drawn. A figurative thing that I've drawn. So these are the veins, and then when they are dropping down, you find the piles. You see? These are the piles. The piles are veins. You see, as they drop down, they come. This is the anal area. So at the anal area, you find them popping in. So when you are passing stool from the anus, you as they brush through the veins, you feel pain. You feel pain. You feel it's painful. But you know, there are some types of types. It's just some hemorrhoids. We have types of hemorrhoids, and these types of hemorrhoids are many. So there are internal hemorrhoids. I have had let me read this one from Coffee Cakes. I like experiences, because experiences, they like helping a person to be okay. I've had them. Bad being in a chair. Yes, when you are seated, because you are sitting on them, you see, you are sitting on them. Bad being in a chair because you are sitting on them. It can feel as if you have chili seed stuck in your rectum. Yes, burning and sometimes bleeding, my friend. They are not good. They are not good, Coffee Cakes. I know when you have them, you are so struggling and pain, and those issues of pain. So we have located inside the rectum. Features are usually painless inside, because now you are not sitting on them. Bright red during defecation, and may prolapse, come out through the anus. There is some people that have them, the hemorrhoids that are protruding, and they may come out through this anus here. They come out through during defecation. During defecation, you can get them. Now, degrees of mean joy. Hi, mean joy, mama joy. My guys, those who are not Kenyans, we have when you hear someone is called mean in our language, language somewhere, one of the communities, it is called mama. Mean mama, or mother too. So mean joy means mama joy. You know that. Mean joy. Welcome, mean joy. Mean joy, today I've decided to give people a welcoming note, and the welcoming note is this one. Tell them.
Let me get to know.
Let me get to know you. That is mean joy. Welcome to the platform, and we are talking about hemorrhoids. Hemorrhoids are called piles. I'm okay now that I've been I know how to eat right, water intake, and try to walk more. Apples work for me. Very true. Yeah, thanks. Big up, mean joy. Feel free to ask me anything, and tell us if you have ever met someone who has piles, or a person who has or you yourself, if you've had this experience. So grade 1 is bleed but do not prolapse. When you are going to the loo, you just bleed, but they don't come out. You just bleed, but they don't come out. Following from the shop, I see clothes, I'm listening. Oh, from the shop, anywhere, anytime. Do you sell clothes, or you are shopping, or you are I sell. Oh, even men's clothes, like men's clothes. You know, I'm a very bad person when it comes to buying my wardrobe. So if I know anywhere, anytime he's selling even men wear, if I have a contact and I see she has posted something, she has posted something, I can always do what? Ask, can I buy this? So Minjoy, please let me have your contact on my WhatsApp. If you are posting there some things, maybe I can be shopping. Oh, I'll give my wife your. Now you just am employed to sell. Okay, you can just give me your number. Maybe my wife can be interested. You know, we have to make people. When you have friends that are doing things that that are necessary to your life, promote them, because they are your friends. Don't go to buy things to other people, and you have friends who have the same item that you need, and they are your friends. Promote your friends, my friend. Don't feel bad when you're promoting yourself, your friends, because when you have problems or you need them, they are there for you. So even in business, be professional. Promote them professionally. You get? So that was by the way. By the way. Let's talk of the grading of piles. The first degree is you have the piles. When you go to defecate is passing stool, you bleed. When you go to defecate, you bleed, but they don't come out. And grade 2, prolapse during training but returns potentially. Oh, you know, grade 2 is when you are passing stool and it is hard, you are straining, they come out, but they return by themselves slowly. They return by themselves slowly. That is grade 2. Grade 3, they prolapse and you are seeing some bleeding, but you should return them. You know, there are some people who, when they come out, imagine when they come out from the anal region, when you are pushing stool, you can just push them inside, and then you are okay. They go inside by your hand. You wash your hand, then you push, and then they return. But grade 4 is when you are bleeding, you have gone to defecate, you are going to pass stool, but you cannot return them. You have to find a doctor to do that for you. External hemorrhoids. We have types of hemorrhoids. Now you see we have external hemorrhoids. What are external hemorrhoids? External hemorrhoids are painful. External hemorrhoids are painful, swelling around the anus, itchiness. They are itchy and difficulty in sitting. But the other ones that are internal, they are not itchy and they are not difficult when you are sitting. You see, they are not when you are sitting. So there are others that are called, you know, there are types. So when I'm talking about this, at least you already know which type you had if you have this experience. Or let me repeat the degree of internal hemorrhoids. The degrees. The first grade is they are bleeding but do not prolapse. They are bleeding but they do not prolapse. The second one is prolapse during straining but return potentially. Without, when you are straining to push stool, they will come out, but they return by themselves. Inside, you see, look, this was how I've drawn. So they may come out when you are pushing in the loop. You are pushing, they may come out, but in grade 2, return by themselves. Grade 3, prolapse and require manual reduction. They cannot go back by themselves. You have to push. You have to use your hand to push back. You have to use your hands to push back. You see, you have to use your hands to push back and reduce them manually. But grade 4, permanent prolapse and cannot be reduced. They are permanently prolapsed but cannot be reduced, you have to go to the hospital. Now that is grading off. That is the grading off. The grading of what? The first one, which is internal hemorrhoids, and then we have external, which are very painful. If you have hemorrhoids that are painful, most of them are usually external hemorrhoids. Most of them are usually external. They are very painful, and you feel like scratching. External means they are just on the walls, on these walls of the rectum here. They are just here on the walls. This one, you see, they are just here on the walls, just here. So they may come out anytime, and when you sit down, you are pressing them. That's why you feel pain and difficult. Marvin, Marvin 8882. Welcome, Marvin. You are surprised about this. It is true. They are very painful when you sit down. You see. So I know some people have them, and some people are listening to this as a new thing. Marvin, how? Yes, but can happen to you. Yes, some people are listening to this as a some people are listening to this as let me say something like a movie. Hello, Dr. Alice Stream. Yes. Here it is 5 p.m. Forgiveness in the narrated. You are the one who told me to talk about this. So this is your topic. Hi, forgiveness. That is from Coffee Cakes. Some people are listening to this as a movie because they have never seen and they never heard this. But I want you to know this is the reality. Some people undergo these things and they are painful. Let me check some noise coming from the background. Yes, it has gone down a bit. So don't look at this as a movie. Forgiveness is underrated. I thought you will start at 6:19. 16 is 4:30 p.m. 4:30 p.m. You see, Margie, greetings everyone, Margie. We are talking about the piles, the hemorrhoids. So if you are coming in right about now, we talk about the piles. The number 3 is you get thrombosed hemorrhoids. I've talked about at what point do doctors determine surgery is needed. When it is grade 4 for the internal hemorrhoid. Grade 3 and grade 4 can need surgery. Can need surgery because if they are coming out and you need to return every time, and when they are coming out and they are bleeding, what you can have is sepsis. You can get infections because they are blood vessels, so they can pick up infections. So at that grade, you need some surgeries. Grade 4, permanent and prolapsed, you need some immediate surgery, but grade 3 you can determine by yourself. T Beauty, welcome. Dorothy, come with them. Welcome T to the chat. Welcome everyone who is here and who is watching. Now, I've said that grade 3 and grade 4, grade 3 in internal hemorrhoids, that one you can determine by yourself. Grade 3. So T is here, and T, I want to play for you a tune of the day.
Sleep with me. Let me get to know you. Ooh.
Yes, for the new people, let's get to know you. Let's get to know where you are chilling from. If you have a question again, just got off work about an hour ago. Right. Let's talk about the grading. Onik is here, my friend. Welcome. Come in. Onik, today you are here. We're talking. Come in. You're talking about hemorrhoids, and I want to grade them. We want to grade the hemorrhoids. And let me handle something here. Then I'll be back. Onik, I can see you. Yeah. What is up? Missouri. What is up? Abdominal pains, diarrhea. A minute, I'll be back. And headache and dizziness. Are you having a diarrhea? And say, the stethoscope, make up, feel the boil sound. Boil sound, feel it. When did you start having the diarrhea? Yesterday. What did you eat yesterday? You ate smocha. What? Okay.
It's spicy.
And it was spicy. Oh. Sunday. Okay.
But I didn't take it.
Nana diarrhea. So that is acute abdomen. Acute abdomen secondary to something you took. How do we treat it? Gastroenteritis. 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 You give ciprofloxacin. Niacin. And stethoscope, Niacin 10 ml and omeprazole. Or you give the omeprazole 40 and to me once in a while, in a day for 5 days. Is it omeprazole baby now? This boy is becoming a big boy every day, or you are becoming a big man every day. Are you a man or a boy? A man. You are confused between a man and a boy. And a boy something. You ate something and it became bad. You raise this idea. Any question? You are Yes, we'll go to school. Yes, go to school tomorrow. Sawa sawa. Acha mpezo dawa atakuwa sawa. Haya. Stan's Kitchen. I can see Onik here. I can see you all. Yeah. You confused between a man and a boy. That one is not. Yes. We were grading internal hemorrhoids. We were grading internal hemorrhoids. Hemorrhoids have let me give this. Onik, where is save your friend, Savior Man? Onik, where is your friend, Savior Man? From Benin. This is a figure of someone, and this is the rectum. So the blood vessels, the veins are going like this. The veins are going like this. So you can get a pile that comes out of the rectum. You see, you can get a pile that comes out of the rectum, and that is what we call hemorrhoids. And hemorrhoids are let me see. Okay, we hemorrhoids are painful, but they are graded. There is someone here. Minute. Onik. Where is Onik? Onik, oh, you're still here. Yes. We continue. If you have any question concerning, wait, say that again. What do you want me to repeat? T. T. What do you want me to say? Now, let's get to check the degrees. Let me repeat. I'm doing well, Onik. Remember, I need no reminder. Stan's Kitchen, you are always a jovial mom. I like that. I like how jovial you are. Always, Stan's always jovial. Now, there is grade 1. It is bleeding, but do not prolapse. They bleed, but they do not prolapse. Doctor, how are you? I'm fine, Onik. I'm fine. Today is a good day. You see, today I'm not looking like I'm sleepy and tired. People are telling me the other day I was looking sleepy and tired. Today I'm okay. My body, I don't have a channel. Okay. Now, bleeding but do not prolapse, that is grade 1. Grade 2, they prolapse during straining and return spontaneously. When you are straining and passing stool, they come out. When you are straining and passing stool, they come out. That is what I mean by prolapse. So, for grade 2, when you are straining to pass stool, they come out, but they return by themselves. Grade 3, they need to be helped to return. And grade 4, permanent prolapse cannot be reduced. You cannot return them inside your rectum. You see? So that is the grading of hemorrhoids. And then we can say grade 2, external hemorrhoids. Now, these ones are the problem. These ones are the problem. What's up, T? What's up, T? T, tell me what's up. These things I'm talking are complicated. These things, these are called piles. Piles are complicated. Look, my friend. These are piles coming out of the rectum. These are veins, so they have protruded and coming out. So there is external ones. The ones that are out from this anal region. These ones are painful. When you sit down, you feel so more pain. I have a question like this: what we eat every day affects the brain? Yes, what we eat every day affects the brain. If you are an alcoholic, you take coffee every day, you'll be using stimulants, so they are stimulating your brain daily. Oh, I don't want to look. T doesn't want to look. Doctor, can they treat back without pushing him back? Can then retreat? Yes, coffee cakes, they can retreat. That is grade 2. When you push and when you push stool is out, they return back by themselves. That is grade 2. Grade 3 is that they have destroyed, they are really destroyed and they cannot come in by themselves. So you push. And grade 4, that one needs just a doctor. You cannot do anything, it needs a doctor. T, oh my God, Onyx, let's disappear. Yeah, T, don't disappear. Listen, because one day you'll meet a person who has these things. Forgiveness is underrated. Where are you? Talk to the people. You are the one who asked me to talk about this. Forgiveness is underrated. Where are you, forgiveness? Now, external hemorrhoids, external ones, they are painful, swelling around the anus, itching and difficult in sitting down. When you sit down, you sit on them. My friend, you feel like fire is burning you down there. When you sit down. When you stand up, you are okay. My friend, it gets worse when you have a diarrhea and you have ate spicy foods. You cannot like to go to the, oh boy, I can't believe my eyes. It's Buzz, and T has retracted that message. T has said, oh boy, I can't believe my eyes. You know, T has never seen it. T has never seen these things. You know, T has never seen these things. Yes? Mwambie tu akuachie namba ya mom. Then if you hata tuma with content. It's okay, no problem. You see, sometimes when you have taken spicy food, pepper, and then you are having a diarrhea. Hey. My friend, you will have it rough. You will feel like the whole world is burning. Never seen and never of it. Now, hear of it. One day you will meet someone in your family or someone who is a friend and you will have to help. External hemorrhoids are difficult in sitting. They should not even try food from Stan's kitchen with her aromatic hot liquid pepper. Just imagine Stan's kitchen. Now let's go to the other one. Those ones who are external hemorrhoids. Let's go to thrombosed hemorrhoids. A blood clot forms inside a hemorrhoid. Features: sudden severe pain, hard bluish lump, because when a blood clot happens, like let me show you this. When a blood clot happens here, it blocks blood from flowing directly to where the hemorrhoid is, so it turns blue. Anything that is blue means lack of oxygen, which is, what grade is that? This is thrombosed. The grading system is, it can be thrombosed and grade 1. It can be external and grade 1. So this one is just a type. You know, grading is about how they come out and how they don't come out. Grade 1 is if you have thrombosed hemorrhoid, if you have external hemorrhoid or internal hemorrhoid that bleed but they don't come out. Grade 2, they are coming out, but when you finish defecating, passing stool, they return by themselves. Grade 3, they don't return by themselves. You have to help them to return. After you have passed stool, you have to push them back. Grade 4, they cannot go back. You need to be taken to a hospital so that the doctors do immediate surgery. They can be internal, external, or thrombosed. Now, thrombosed means that one of, I think no one experienced the pain they are laughing now. Cry later. Yes, forgiveness is narrated. If you have not ever experienced the pain, you can laugh. That thing is painful. Hey, disappear from here. They talking about pushing hemorrhoids back. Yes, that is what people do. That is what people do. T. Some people are undergoing these things and it's their daily to day life and they are used to it. As they think about what T for women can help with child labor too. Yes, for women, when you're having a child because of high pressure, it can happen. It can happen because of child labor. Now, thrombosed is where you feel the bluish coloration that is on because of a clot that is not making blood to go to the hemorrhoid. You see, swelling and it is swollen and there is inflammation. Causes of hemorrhoids. Let's talk about the causes. Now, this is where that one was an explanation. Let's talk about the causes. Let's talk about the causes. What are the causes of hemorrhoids? What are the causes of hemorrhoids? So, new person, anyone who is new to the platform and is coming in right now, you know, we talk about medical issues. We talk about some issues that are affecting our bodies and even mental health. So, if you have any question concerning what is going on, any question that is concerning anything, just come through and ask, and we will answer you about it. Now, what are the causes of hemorrhoids? What are the causes of hemorrhoids? Prolonged sitting, fiber, and dehydration. Yes, dehydration can cause constipation, and you may develop hemorrhoids. Constipation leads to hard stool. Common causes include chronic constipation. Every time you are eating, you feel constipated. You feel your stomach is. Can it be cured? Yes, that is where we are going. It can be cured. Stan's Kitchen, and we will see how it can be cured. You see? So coming in, check if you have liked. Diet, very important. The diet is very important. To these people, diet is very important. Now, I'm telling people, if you are coming in and you have not subscribed, the new guys that are here, please talk to the people that are in the chats. Relate to them. Relate to them. Hi, Margaret, I can see you here. My sister Maggie is in the house. Margaret, we are talking about hemorrhoids. We are talking about hemorrhoids, and they are very complicated issues when it comes to daily-to-day things that we do. Daily-to-day things that we do. You see, like T today is surprised. T is surprised when he's hearing and looking at the image, saying that, wow, it is that painful. T, people are suffering, and it is not a laughing matter. Grade 3 and 4 It's something that you cannot. Yes, it is disgusting, but people are being helped. Now, increased pressure in rectal veins can cause chronic constipation, straining during the bowel movement, chronic diarrhea. Every time you are having diarrhea because the piles are out and the rectum is open, so it's just passing. You get pregnancy when giving birth. You can have high pressures and they cause the piles, and how the baby sits. The uterus sits back on the rectum, so it can cause you to have piles if you are pregnant. At times you don't do any exercises. Pregnant. I'm sorry if you have it. No shade. T is saying she's just surprised, and if anyone has them, please forgive her. She's sorry about it. No big thing. Some things are laughable because they look disgusting, but it's nature. That is a T. When women are pregnant and you are lying on the side, they press the rectum and they press the veins there, and you form the piles. You get obesity, heavy lifting, gym, people that go to the gym. So my sister, when you are Margaret in Norway, when you are lifting and doing the exercises, when you feel that you are pushing it, and it is the place that you can, Margaret, you are moderator here. Yes, Margaret is a moderator. When you are pushing and you are pushing and it's beyond the place that you can push, we don't push anymore, because when you are doing, when we are going to the gym, we push, we try to get the muscles. The body is compensating by pushing the pressures in the veins. It's pushing the pressures in the veins. So you may feel that now today I'm working out. You know how we do it in the gym. Yes. Give me 1. Give me 2. Yes. And then the instructor is telling you, go on. Push, my friend. Push. Give me 20. 1, 2. Your inner vessels are giving themselves pressure so that they can give the muscles oxygen and the brain oxygen. So when you are pushing, the heart compensates by pushing down the real weight to the arteries and veins. So the veins are superficial. They do what? You start having piles by pushing. If you have ever gone to a gym and you have seen what they do, my friend, I go to the gym sometimes and working out, push 1, 2, 3, again push 1, 2, 3, because you want to catch up with some people. You are there, you are struggling. Push. The veins are receiving more pressure, and when the veins are receiving more pressure, what do you get? Piles down there, because your rectum is soft and piles are coming out. This rectum is soft. So when it's giving this pressure, it pushes out. I don't want to get hemorrhoids. Margaret in Norway, you understand how you work out. You don't work out so heavily. There are some people, they're bodybuilders. There was a time I was going to the gym and I was lifting at around 80 kgs. We would go up to 150 kgs. 150 kgs. The back bench. For those that go to the gym, you understand the back bench. People are helping you to push 150 kgs. When you are coming from the gym, your hands are here. You are walking like a duck. Because you have pushed muscles, and these muscles are painful, and you forget that you are exposing yourself to piles. Nowadays I've had so much I'm doing. I don't go to the gym often. Now I have talked about heavy lifting. Let's talk about sitting for prolonged periods, mostly for people that are clerks and secretaries and other people. Name them. Please help me name those people that sit down for long hours. In the government places, offices, you may find some clerks and the tellers that are sitting down for so long. Margaret, no one wants to. but it happens. The old adage, an apple a day, keep doctor away. I get it now, lol. Yes, eating good and eating some nutritious organic food. Don't laugh, karma is real. Yes, don't laugh, karma is real. Onik, how does playing sports positively and negatively affect the brain? It depends on which sport you are playing. Ben, BDBGP. Hey, give me a name that I will be calling you. You see, calling you BDBGP. Come on, man. Give me a name, man. How you feeling? You living? How you feeling? How you living? I'm cool. BDB is cool. BDB, welcome. I'm cool, BDB. I'm just talking about hemorrhoids today, and some people are really surprised. So I'm feeling good, BDB, and everyone, BDP is asking you, how is you everyone? How is everyone? Yes. This is a place where we talk about medical issues, things that are affecting everyone. And when I'm talking about something and I'm smiling, just know doctor is always a happy person. So don't take it negatively. I'm always happy and I love telling people how. Yes. I've asked a question. Which profession do you know that they sit down for long hours? Tell me, which profession do you think they sit down for long hours and they don't stand? Most of them have piles. Which profession is that? Sitting long periods, low fiber diet, aging, work from home jobs. Work from home jobs, like which one? Writing, center call jobs. Yes, center call job. Truck drivers, very true. Truck drivers sit down for so long because they cross borders and they have time to deliver whatever they have been given. And something else is you cannot go past somewhere at night because of security reasons. So you have to sit and drive because you have been given time. So let's talk about low fiber diet. People that like eating processed foods and foods that may give what? Diarrhea. Aging. If you grow old, like Uncle said, limousine drivers. Okay, yes, the limousine drivers. If you are a driver and you drive so long hours, it is very important you stop, you walk a bit, you go somewhere, you come back. With yes, constipation, chronic constipation, even chronic diarrhea can give you this. You see, and there is something that is noted. Most of people that are asthmatic can get piles. I know someone may feel this one is funny. Chronic cough can give you piles. Asthmatic people with bronchiolitis, chronic bronchiolitis, it is causing chronic coughs. Chronic coughs can give you piles. Check percentage of people that are having chronic coughs and asthmatic people. You will see that they have piles. You get that. Now let's see the risk factors. Where is forgiveness is underrated? Are you still around forgiveness? Forgiveness, are you still around as you listen? Now, people at high risk include pregnant women. The first people that can have piles is meds can make you constipated. Some supplements too, so got a balance. Yes, meds can make some people more constipated. Meds can make people so much constipated. You see, it's very important you balance the medicine that you are taking. It's important. Now, pregnant women, we have said, because of the uterus and the weight from the baby plus high pressures that come. Elderly people, often have this obese often because of weight, and obese comes with high BPs, high blood pressures. Who has any question, my friends? Or I'm just talking so much and I'm not giving people chances to ask or add. If you have something to ask or add, please ask or add something to the talk. Yes. Okay. Patients. We have talked patients with chronic constipation. Patients with chronic constipation can have. I just never understood that the food went into the stomach acid. The food went into the stomach acid. Why? Still hard. Why it's still hard? Because you are not rehydrated, and when you have problems in your stomach, you get dehydrated because of diarrhea. So when you diarrhea a lot, what happens is, when you get chronic diarrhea, you remain with constipation afterwards. Or when you have dehydration and your body is not absorbing fluids as per needed at the rectum, you remain with problems, constipation. Constipation. You see? So let's get to know how it happens. After people have been so excited, and some people have not ever got to know. Some people have never got to know these problems can occur. Some people have never got to know these problems can occur. So normally veins in the anal canal helps to control stool passage. The veins that are at the anus, they help to control how the stool is passing. When pressure rises, like constipation, and there is so more stool, veins dilate and swell. The veins dilate and swell, supporting tissues weakening. You get? So the tissues that are here around the tissues that are around the anal region here, the tissues that are here, they weaken, they become weak. When they become weak, veins prolapse downwards, just as I've drawn. You see, the veins prolapse downwards like this. They come downwards. Inflammation and bleeding occur. You start bleeding because when the veins prolapse, they contain blood inside. So what will come out? Bleeding will come out. And what are the symptoms? Common symptoms in a person who is having the normal prolapse. What are the symptoms? Bright red rectal bleeding. Pain during stool passage. Itching down there. Pruritus ani. We call it pruritus ani. Pruritus ani. Itching. Mucus discharge. Yes, and if you take Metamucil, it can dehydrate you, so must drink even more water. Yes, when you are in some drugs, you have to drink more water. If you taking guavas, some fruits can give you constipation, like guavas with a lot of sodium, absorbing in the more water in the body, leaving you constipated. When you take guavas, mapera. For those that are in Kenya, guavas, we call them mapera. Just take a lot of guavas, you will see. And banana too. Can help you at times, but sometimes it can be a problem for bananas. So guavas are problems to people who have piles because they give you a lot of constipation, and the constipation brings problem. Is it the potassium you think? Yes, guavas have a lot of potassium. Bananas and potassium can help you soften the stool at times, but the other way around, it can give you some other problems. It can give you some other problems. But when you mix bananas and pawpaws, you get a good white bread too, doc. Yes, white bread because of yeast that is used. Greetings, Dr. Ben and the chat. Welcome, Sha Travels. Welcome on this chilly day here in Kenya. chilly day here in Kenya. Here we are talking about hemorrhoids today. Hemorrhoids, which are called piles, and potatoes. Yes, bananas help with diarrhea. Yes, so you have to balance the fruits. Yes, yes, I know. You know, guys, Sha Travels always supports everyone who is closer to her, and when at this time Sha Travels is always working. So when you see a text and she's not here texting every time, just know Sha Travels is at work, and we understand. Tendai Soko, hi dog. Tendai, hi. Which side are you watching from, Tendai? Tendai, which side are you watching from? Tell me which side. And if it is the first time here, Tendai, or I'm mistaking you, just tell us it's the first time or I've been here several times. We are talking about hemorrhoids today. Hemorrhoids. So swelling near the anus, lump around the anus, feeling of incomplete evacuation. When you have passed stool, you feel you still have more stool to pass out, and you feel this way. You feel this way because the piles are mimicking stool. So you don't push a lot. No, you don't. You will have a problem if you continue pushing a lot. You don't push a lot. You at least leave it. When you push slowly. If you have it, you get push slowly. Severe symptoms are like severe pain, prolapse, infection, and ulceration. Those that have the piles, the hemorrhoids that have thrombi, the hemorrhoids that have thrombosis inside, that are blue, are obstructed. My friend, those are painful, because one thing, I'm watching from Zambia, first time. Tendai, welcome, thanks a lot. Hope you have subscribed today, and will be meeting us every time. Tendai, welcome, and share the channel. Tell your friends. We have a community that talks about medical issues, and it is called Benjamin the Wise Guy. Talk to the people that are in the chat. They will welcome you. We like friends and we like new people here. Tendai, welcome so much. Talk to the people as they welcome you in. And if there is anyone who is here who is new, don't fail to tell us. At least chat tell us I'm new here. What do you do? We do many things. Mental health talk. This week, I'm giving chances to every person. We have where is that paper of mine? Oh, it's here. I had requested to talk about several things, and those things are the ones that I'm following. I'm not giving myself any topic. These are the topics that I wrote down, and we'll be talking about them. I'll go through them all. Now, forgiveness in the narrated is saying, is it possible to have hemorrhoids without knowing? Yes, you can. Most probably the internal ones. Dr. Benjamin, what is your specialty? For general, but cardiac issues is my specialty. But I can do any general. Cardiac is the heart, not emotions. Physical heart, the coffee cake. Cardiology, physical heart. That is what is where I'm getting to, and where I have the passion. But general, I can. You see, I'm talking about things that are meant for other people, like the people that do surgery, general surgical professionals. So welcome coffee cakes, welcome coffee cakes. And you see, the cardiologist is giving you even good emotions, feeling nice, feeling good inside, relaxing your heart, relaxing your brain. When we come to Feel Good Friday, you smile and you feel good, so you make your heart be cool. So we do everything here. Yes, I'm here but in the kitchen because I just came back on the walk, and my family and friends. Nice. Uncle, tell your family and friends, and I'll Yes, yes. Nene and mom. Nene and mom. Nene and mom. Nene and mom is here. Greetings, Doc. Well, greetings, Nene and mom. We are just talking about we are just talking about piles. Today I've decided to talk about piles. Greetings, Dr. Ben. Greetings, Dr. Benjamin. I see the classroom is live and assertive. Hey, you see that? Even Smiler in the city has agreed. The classroom is assertive. Assertive. Assertive means there is doing good. You see? And Uncle is Smiler in the city. Read it, doctor. Oh, then how treat it or prevent from escalating? Where are side effects of having it without knowing? Okay, forgiveness is underrated is asking how treat it or prevent from escalating. What are the side effects of having it without knowing? That is where I'm going. Forgiveness is underrated. Just now, that is where I'm going. So, Smile in the city, Jamaican uncle is here. I see he has said, I'm here but in the kitchen because I just came back from walking my family and friends. Yes, good. Welcome, uncle. We know you are the emperor and you're always with us. So, let's talk about signs and symptoms. Inspection, swollen veins, prolapse symptoms, prolapse skin tags and bleeding. Those signs and symptoms. Swollen veins, when you look at person's arms, you see protruded veins. You see, digital rectal examination, the one that men don't like. Greetings, coffee cake guy. Men don't like that thing. Digital examination. You may fight with men because of that. And you know, sometimes I felt weak and well. Oh, okay. Coffee cakes. Yes, when you're feeling weak, you know, it's one sign because you are bleeding and you are losing blood. Digital rectal examination may reveal internal masses. When you pass your finger down there, you feel some masses, tenderness and blood coming out. There are some things we do to check if you have them. These things are called proctoscopy, anoscopy. Anytime you hear anoscopy, you know it is a camera that is viewing inside. Usually visualize internal hemorrhoid. If any time you hear a word that is ending with scopy, you know it's a camera that is inserted inside and is giving us pictures from inside. So how can you know about it? You know, people feel pain at the grade 3 and 2 because of anal fissures. When the veins come out, they leave cracks. Those are fissures. The cracks are the ones which make you feel pain. And when you are having a diarrhea, some diarrhea contains salts and some fluids. So when they are passing there, the salts that are in the diarrhea are the ones which are burning you, and they make you feel like scrubbing down there every time. You get? Rectal prolapse. Rectal prolapse are when the veins come out and the rectum comes out. Most of the people that are of the other things, the ones that doctor can prescribe steroid suppositories to help too. Yes, we are going to treatment. We will see about that. So rectal prolapse is when the rectum comes out. People with and it can be confused because people with some complications like let's say this one is called the people that are men to men. You get? I don't want to name them. The people that are men to men relationships, they can have that. So don't confuse that with the one that is hemorrhoid. Hemorrhoidic rectal prolapse, it comes when it is with the piles. It comes with the piles out, you know. So that is rectal prolapse. Then you can get, because those cells are epithelial cells, that are secretory cells. They secrete some things and they absorb. They are supposed to be inside, not outside. So when it is coming outside every time, it exposes you to have mutations of the cells. So you can have colorectal cancer. Because of the coming out every time, you can have the colorectal cancer. So we have another thing called polyps, protruded masses. Anywhere, anytime is back. You are back, that's nice. So you see things that you can have. Those are things that you are exposed to. Because the anal is coming out every time, it's coming out every time, and when it is coming out every time, what do you get? The epithelial cells are exposed to environment that they are not used to, so they start mutating and you get colorectal cancer. Polyps are piles that are coming out, protruded piles that are coming out. If they are inside, is it genetics? Every stage can be genetics, even if it is internal, external, can be genetics, because there are some people who are born with some vessels that are weak. So it can be genetic inside or both outside. You can abscess. I am Naliaho. I am Naliaho. You know, in my language, if you say Naliaho, it means eating and being sad. Even me, I ate. So Naliaho, welcome to the channel. We are talking about piles. We are talking about hemorrhoids. Welcome, I am Naliaho. Hello, Dr. Benjamin. Welcome, I am Naliaho. Thanks for tuning in. Thanks for being with us, big boy Naliaho. So because T is still here and T is telling you hi everyone, and please tell T hi again. Tell welcome back, I am Naliaho. Let's talk. You can these ones are things. Is it possible to have it since childhood? Yes, you can have it since childhood. But since childhood, when you are growing. Naliaho, have you ever met someone with hemorrhoids? Naliaho? Now, those are things that you can have and confuse them with. You can have them and confuse them with hemorrhoids, anal fissures, rectal prolapse, colorectal cancer, polyps, perianal abscess, and fistula in anal. Women know what fistula is. Fistula is abnormal communication between vessels or someone has said never met someone but they say it's very painful. Yes, anywhere, anytime, it is very painful. Doctor, I must go, need to get ready for Dr. Okay, I will rewatch what I miss. Have a awesome day. Yes, it's okay. The coffee cakes, we will meet at 2-3 hours from now if you will have come from your appointment. I hope everything will be okay. And share what I shared to you to your doctor, please. Share it to your doctor. Rewatch. Okay. Does it cause skinny body? Yes, it can cause skinny body because people fear to eat. When you are eating and you have a problem, you become skinny because you don't want to eat a lot because of the complications, external out and internal inside. Yes, external out and internal inside. Most of the internal ones, you just realize them by bleeding and pain, but they don't come out. Let's talk of complications that you can have. The complications that you can have, like thrombosis, blood clot formation causing severe pain. Dorothy, go and sort it. Blood clot complications like severe pain. You get, when you have a thrombi, you will have some blood clot and it will be painful inside the vein. You get, Those ones are things that we are avoiding: blood clots and complications. Does it cause stress in stomach or unnecessary anxiety? You can have anxiety, and also because you are eating so little and some foods that you are always thinking you can get what you are always thinking. Doc, you have not answered my question. Which one? Which question have you asked? Let me see. Channel activity. Doc, what's the difference between external and internal hemorrhoids? External hemorrhoids are seen down there at the, you have come right now, you haven't seen. Look at this. External hemorrhoids out, they are within the lining of the rectum. Internal hemorrhoids are within the muscular side inside. The muscular side inside. You get? So let me highlight with this. What I've drawn are external. You see, they are popping out of the anode region. So there is internal that you will find it's like just like a boil, but it is inside from the muscles. But when it is coming to the layers of the side of the anus, you feel it is just like a little pimple, but inside is big. So internal mostly are in the muscular inside, but external, they have popped out and they are outside. That is the difference. I hope you have understood that. That is the difference of these things. Does it cause stress in the stomach or just unnecessary anxiety? It causes. If you are bleeding, losing blood, you are getting dehydrated. And then the other thing is, after you have become dehydrated, the other thing is you start having a stomach gastritis. You start having stomach. Pay attention to the teach. Lol, just kidding. You start having gastritis. If you start having gastritis, diarrhea. So it's not a necessary anxiety. It is there and it happens. So let's talk about thrombosis complications. Because you are bleeding, you will have anemia. Strangulation, when it comes out, it can twist and then it gets strangulated. And prolapsed fibrils is they become strangulated. What they start having is necrosis. They start rotting. Yes, infections, most of the infections, but most don't have, because they are just veins that can be returned inside. Ulcerations, breakdown of the place that vein has come out. Fissures, that is what we call fissures. The ones that are painful. Doctor, I think my brother has it. He's in the skinny since childhood. He is saying he has like lumps in the rectum. Yes, that one is it, internal ones. Those are internal ones. Yes. So forgiveness, you should go and do for him anoscopy to check if they are real. But I'm sure that is it. It can be it. It can be it. So when you like how forgiveness is underrated, is saying he thinks the brother has it. You can go to do anoscopy or proctoscopy to check if you have them, to check if you have them inside. Anoscopy or and then there is something called sigmoidoscopy, colonoscopy. When they pass down their T-bute, your answer was a shortcut. I am Nalia. Oh, yeah. You see, now what is the treatment? This is where we are right now. The treatment is always life modification. How do we manage those that are non-surgical? We don't want to take people to surgery. We don't want to take people for surgery, and it is grade 1 or 2. So what do? You increase fiber diet, drink more water, avoid straining when passing stool when you have constipation. exercise regularly, avoid prolonged sitting on the toilet. Avoid prolonged sitting on the toilet. Fiber foods, example are people don't know fiber foods like fruits, vegetables, and grains. They have good fiber that can help you, fibers that can help you. And then if they are worse, now they are in stage 3 or 2 and they are worse, you start using lactulose and Ducosate. These are stool softeners. They are called lactulose and Ducosate. Use paracetamol as pain relievers. You can use paracetamol as pain relievers. And NSAIDs, but be careful with the NSAIDs like diclofenac and so careful with them, they can bring other issues. Topical medication like hydrocortisone cream, drink water and limit ugali. Okay, lidocaine ointment. You do what? You use, because you don't wanna be scratching yourself down there every time. You see, lidocaine ointment. Now, seats bath, warm water baths for 10 to 15 minutes. Benefits of this warm water bath is if they relieve pain, reduce swelling, and improves hygiene down there. Warm water baths and sitting on a bath. You sit on a warm water there. They relieve pain. Now, procedures that can be done. This is mostly on stage 4. Mostly on stage 4. Rubber band cuts blood supply to the hemorrhoids. This one is best for grade 2 and 3, so that when you've placed the rubber band, they fall off. Let me leave them. Tell him how they removed. We have sclerotherapy, injection causing fibroids to shrink. They are called sclerotherapy. Infrared coagulation, heat destroys hemorrhoid tissue. Infrared, so the heat destroys. And then we have surgical treatment, grade 3 and 4. Hemorrhoidectomy. You just do surgical removal by the doctors. If they are recurrent, prolapsing every time they are coming out, you remove them. You just remove them, because if you continue having them, what will be? There will be a problem of every time coming out. You see, open hemorrhoid. We have open hemorrhoidectomy and closed hemorrhoidectomy. Open and closed. Staple hemorrhoidectomy. Stapling technique reposition prolapse tissues, like stepping, coping with them. And there is something called thromboectomy, removing of the clot where it is, for the one that is hemorrhoidic thrombotic hemorrhoid. Post-operative complications. After you have been on an operation, you can have pain, you can bleed, you can have a urinary tract infections, anal stenosis. Anal stenosis is your anus becomes small because of the surgery. Now it cannot expand. Fecal incontinence, because it is small, you start having incontinence. If fecal matter is not coming out, those are the complications. Now, prevention: high fiber diet, adequate fluids, avoid constipation, avoid excess training, physical activities, and good toilet habits. You see, those are the complications that people always see. Avoid these complications. You avoid these complications of by eating well. High fiber diet, adequate fluids, avoid constipation, avoid excessive straining, physical activity, and good toilet habits. So that is about hemorrhoids. Is anyone having any question about all this that we have talked about? You can ask, but there are some things that you should see. When you see them is when you start knowing that there is a red flag and I need to see a doctor. Whoa, these complications are traumatic. Yes, I'm Naliaho. If you have never been on this, or if you are not a medical work and you have never seen this, now you can see them. Now you can see them in reality. Because of people not wanting to eat, they start having weight loss, persistent bleeding, getting anemia, change in bowel habits, severe anemia, family history of colorectal cancer can happen. So these are the important things when it comes to hemorrhoids. So anyone who has a question can ask anything that you feel as we finish this discussion, so that at 9 today I said I want to finish your requests. These are your requests. Spleen function, how to get twins, lack of iron, which let me read them, and then you tell prevention is better than cure. Yes, let me read them so that you can tell me what we can do today at 9, the time that I answer questions from my email. You can tell me what we can do. Someone asked for spleen function, how to get twins, lack of iron and side effects, how to lose weight without gym, forgiveness is underrated, hormonal balance, he had 2, multiple myeloma, that is cancer, how to cure rhinitis, hemorrhoids and treatment, that is what we have done today, complications of POCs, polycystic ovarian syndromes, liver cancer, and complication of the eye from Leila. Which one do you think today I can do tonight? Which one do I do tonight? Because I have to finish this week. I'll continue with next week's topic. Which one do you think I can do tonight? Any proposal that you think? Spleen function, how to get twins, lack of iron and side effects, how to lose weight without gym, hormonal balance, multiple myeloma, how to cure rhinitis, complications of POCs, liver cancer, and complications of the eye. Which one do you think we can do at night today? Anyone who has any suggestion or a question? Suggestion or a question? Tell me so that at night I plan what I can do. Anyone in the house? Anyone in the house? I'm waiting for any suggestion of any topic that I can do at night. I'm fine, grandma of 3. Hope you are doing fine, even you where you are. Hope you are doing good. We are just finishing, and I'm asking which one do you think after 2 hours, the time I come to answers, people are not answering. People ain't answering. Why? Do hormonal imbalance. Oh, okay. I am Naliaho. As said, we do hormonal imbalance. Where is it? I've done hemorrhoid. That one was forgiveness in underrated. Do you have a question? That was your request of today. So hormonal imbalance. Even forgiveness is underrated. They asked that question. I do. So today we are finishing with the request of forgiveness is underrated. Hormonal imbalance, I'll do it at 9 Kenyan time. So forgiveness is underrated. Your request have been okay. I'm not sure on this one, but I'm gonna say yes. Okay, nice one. If you have come in late, please remember to check there, to rewind if there is something you need to know. Just review the go back and rewatch. So at 9:15 we will do hormonal imbalance. Affecting child bearing. So that is what we will do at 9. And so yes, it does affect, because sometimes it wants, and sometimes to get pregnant. Yes, Grandma of 3, you have just come as we finish. We were talking about hemorrhoids. We were talking about hemorrhoids, and we are finished. So that topic we will do it at 9:15. 9:15 Kenyan time. 9:15 Kenyan time. We will do it at 9:15 Kenyan time. So everyone who has been here, thank you so much. All that have been here since 4:30 to 6:16. That is like around close to 2 hours. Thank you so much. Yes, 11:16 American time. Yeah. Thank you so much. Let's meet at that time for those that will be there, so that we can learn something else. Where you are, have a nice evening. Bye. See you at 2 hours.